Hi Morgan, my name is Millie, I'm a student PT. I'll just be going over the different findings in the chart with you today.
Okay.
If you have any questions, let me know. I'll start with the vitals. The first thing I noticed was the increased pulse rate. This just means that the heart is beating faster than normal. This could be related to the recent surgery that the patient just had, and all the stress and trauma from that surgery and the injury.
Okay.
Other thing I noticed was an increase in blood pressure. So it's pretty high, not to the point of a hypertensive crisis, but I do think that hypertension or high blood pressure should be addressed and evaluated just to help reduce the risk of any risk of heart attack or stroke in the future. Other thing I noticed, there was a high SpO2, so this is just the oxygen perfusion or like delivery to the tissues. So this is really important, especially when we get into exercise, when we increase the demands of the body, because in order to increase the demand, we have to have sufficient oxygen to be able to increase those demands.
Makes sense.
And so with exercise, that's just going to be something that we're watching carefully to make sure we're not increasing the demands without the oxygen also increasing.
Gotcha.
Another thing I saw was high MAP or mean arterial pressure. And kind of back to the blood pressure, which helps make up the mean arterial pressure. This is just another increased demand on the heart. And I think addressing that hypertension that we saw will also help address this as well to help decrease the risk of heart attack and stroke.
Okay.
So from the labs, we saw some high potassium, or potassium was within normal limits, but it was actually closer to the low end, and the lower end of that range could indicate some issues with arrhythmias, which is just like irregular heart patterns.
Okay.
But again, potassium wasn't without that normal limit, it's just close to the low end, so it's something that we will keep an eye on. Creatinine, so this was high, and this relates to kidney function. So the higher the creatinine, the lower the kidneys are functioning.
Gotcha.
So that's something that we're going to keep an eye on as well. Magnesium was also high, and this is also indicative of renal disease. So another thing that we'll be keeping an eye on. White blood cell was also high, so this could attribute to any feelings of like fever, illness, anything like that, any symptoms of infection, which also might be contributing to any fatigue that the patient might be experiencing. And then glucose was also high, so this is a number related. A lot of diabetics use this number to watch and monitor their diabetes. And I didn't see any history of diabetes on the chart, but that's something that we'll probably screen the patient for any family history of diabetes. We'd like to probably get an A1C just to make sure that we're effectively monitoring that glucose to alleviate the risk or reduce the risk for diabetes. And if that is something that's existing, we can help with proper education and management to address that.
Okay.
So a couple lines that might be on the patient or connected to the patient could be like a nasal cannula or a mask, which is just a mask or a tube that goes right around the nose to help provide oxygen. Again, this may be because of the low SpO2 that we talked about earlier. And then an IV line, so this can be down the wrist, in the inside of the elbow, and because the patient did have surgery recently, this could be used to deliver the pain medication to the patient.
Okay.
Signs of DVT, so deep vein thrombosis, basically you can just think of this as a blood clot. Sounds scary, but usually we look for those in the lower extremities, so those are going to be any pitting edema. So if you press on someone's leg and they're swollen and it leaves a divot from where you press. That's pitting edema.
Okay.
We're also going to be watching out for any tenderness with palpation or pressing on the skin, redness, or warmth in the lower extremities.
Okay.
We saw that Mr. Weasley needed a vessel cabbage, so we're going to use a coronary angiogram to detect, to test and further evaluate that need for surgery.
Okay.
Two different medications that could be used for the cardiovascular system. So we could look at the beta blocker just to reduce which helps reduce the cardiac output on the heart and helps bring down that blood pressure. And then also an ACE inhibitor. So this decreases the fluid in the body to help also address the blood pressure.
Gotcha.
And then for the DVT or the blood clots in the legs, if a patient did have one, we would want to make sure that they are hemodynamically stable, which means blood pressure would be good, MAP would be good, and the patient would be anticoagulated in order for us to get them up and move them.
Okay.
All right, thank you.
Of
Any
course. Thank you
questions?
for explaining it to me. It makes much more sense.
Awesome.